ER physician Dr. Darria Long joins me now to give you some of the answers. Dr. Darria, good to see you.
Good morning, Susan. How are you?
I'm doing well. That was the question from Chris out of Florida. He wants to know the Chicago jail population. Wow, he says, how did they catch this since they are all behind bars? Was it in the air, food tray, maybe contact, Dr. Darria, with people outside, like the guards? And do we even know?
Well, we'd just be speculating, Susan, but there's really a number of different ways that they could have been. It could have been a guard or a visitor coming in who spread it. It could have been a new or recent inmate, because remember, the symptoms don't develop till 4 to 5 days after you are infected. So somebody could have been infected on the outside, then brought in and spread it to the rest of the prison.
Yeah, and highly contagious. That's what's so difficult about coronavirus, because you just don't know. And Michael in Texas asked this. I'm a husband of a respiratory therapist. What do we do to protect our kids, he says, after our spouses come home from work to make sure that everyone in the household is safe?
This is a great question for Michael and for Michael's partner. Many people may not even know what a respiratory therapist is, but when I, as an ER doctor, am intubating a patient, the respiratory therapist is right there with me, putting the patient on the ventilator, being very close to those patients. So they're definitely a very high risk for being infected with coronavirus. So a number of things. It's really important to be wearing as much PPE, the adequate PPE. And then when you take it off very carefully, because some studies have shown that the process of taking off the PPE can kind of loosen the virus so it gets back out into the air. So don't bring any of those clothes, your shoes, nothing. Don't bring that home. Change it in the hospital. And then I would say for this respiratory therapist, I, as an ER doctor, I worry about bringing the infection home. I forget that I'm bringing the stress home as well. So I would say to that respiratory therapist, you're dealing with so much. Do your best to have your stress outlets, to leave that at the hospital, leave that in the car, so you can come home and not be carrying that stress with you all day long.
I'm so glad you mentioned that, because of the physical and having to kind of discard the clothes and do all the right things, but mentally you have to stay in check if you can as well. And Santa in Utah asked this, is there a link between smoking and more severe symptoms, doctor?
Yes, definitely there is a link between smoking and more severe symptoms. We know it just on a cellular level, smoking decreases your immune system and it increases your chances of catching COVID. And now we've been seeing that in cases as well. We saw a tie between MERS and people who were smoking having more illness. And now from a study based in China, we saw that people who were smokers were more likely to get sick and to get more severe illness. So that counts for smoking, cigarettes, vaping, cannabis, all of those are included in that risk group.
Because that's what it does, attack the virus in most cases, the lungs. As you said, Dr. Darria Long, thank you.
Yeah. Of course.
Well, there were cheers all around. What is so